And all right, we are streaming now to YouTube. I'm going to turn off my camera, but I'm here. If anyone needs tech support, please reach out for your help, and I'll pass you over to our MP, Richard Cannings. Thanks, everyone, for being here.
Well, thank you, Tina, and thanks to everyone for being here as well. Good evening, and welcome to our online town hall on the new Canada Dental Program, Dental Care Program, and the Pharmacare plans for the near future. And I just wanted to start by saying that we're holding this meeting on the traditional and unceded territory of the Syilx people in the Okanagan Nation, and we'll have participants, I'm sure, in the Sinixt and Ktunaxa territories in the Kootenay as well. So we appreciate sharing this beautiful part of the world with those nations. My colleagues and I in the federal NDP caucus have used our power in this minority government to bring a number of, I think, really remarkable programs forward that will really help all Canadians across this country. And that includes, there's numerous, I don't want to go through all of them, but we know about childcare, dental care, the Pharmacare plans, and this evening we'll be covering the latter two programs, dental care and pharmacare. And I'm really happy to have with me someone who I think can be called the real architect of these programs, and that is Don Davies, who throughout the planning and development of these programs was the NDP health critic and was really there in the rooms with the government, making sure that these programs will work and do what we know they can do to help Canadians. And so Don is a real expert on these things, and I'm so glad that he's here today to help us through understanding where we are with these programs. And first of all, I just want to say dental care, this is something that will really change the lives of so many Canadians. Really, I've talked to so many people over the last couple of years, people who've literally broke down crying when they talked to me about what this would mean to them, or wish that they would have had that when they were young and growing up in a lower income family where they didn't go to the dentist, kids who've had their teeth pulled, early in their lives, and it really affected their whole social world through their lives, affected their jobs, everything about um, how they could relate to other people. And this will change all that for millions of Canadians. And I think I'll just turn it over to Don now to talk about part of you can talk about some of the impacts that this will have, how many people it will affect, how many people it will help, and how it will really help all of us in Canada. So I'd like to welcome Don Davies, the MP for Vancouver Kingsway. Thanks for being here.
Well, thank you so much, Richard. It's really an honor and a privilege to join you and your guests here tonight. First of all, I'm privileged to be zooming in from the unceded traditional territory of the Coast Salish people. That's the Musqueam, Squamish, and Tsleil-Waututh nations, by whose grace and permission we live, work, and play. Um, Before I jump into dental care and share some information with you all, and I look forward to the questions and comments that you may have tonight, I do want to say a few words about my wonderful colleague, Richard Cannings. I think I'm going to say something that most of you who know Richard already know, which is Richard is one of the most deeply intelligent and informed people in Parliament. He is incredibly thoughtful. He conducts himself very graciously, and I know sometimes we think of Parliament as a place where people are not behaving properly or they're heckling or yelling. Well, Richard brings a grace and a maturity to our House of Commons that I think just does credit to the institution, and he elevates the debate and elevates the standards of Parliament. And so I want to thank you all for having the wisdom to elect Richards and for sharing him with us. He's a great defender of the interior of BC and of our planet. And I just want to thank you all for sending such a wonderful representative for you and for all of Canada. I guess where I want to start with dental care a bit is just some basics. One is dental care is primary health care. I'm going to repeat that because it's so important. Dental care has sort of become to be regarded as a little bit of a luxury or a cosmetic aspect of health, when in fact it is basic garden variety primary health care. And it has been I think, a shameful gap in our public healthcare system for far too long. Interestingly, in the 1960s, when we were forming our national Medicare system, Tommy Douglas brought it in Saskatchewan, and the NDP, the CCF in the 1940s, and the NDP used our power in the early 1960s in a minority Liberal government similar to today to compel the Lester Pearson government to bring in Medicare. But at that time, there was a study done by a retired Supreme Court justice named Emmett Hall, who looked at Medicare. And out of that recommendation, not only did Mr. Hall, who was a fairly conservative judge, not only did he recommend public health care, that health care is best delivered through our public system, but also that it should include a number of comprehensive services, including dental care. And the only reason that dental care was not included in the 1960s along with physician care and hospital care is because they didn't think at the time that they had enough dentists per 1,000 people to actually be able to deliver services. Happily, that is not the case now. There are far more dentists per capita than we need in Canada to deliver, although, as I'll get into a little bit later, not necessarily evenly distributed in rural and remote areas. So that's a problem that plagues our healthcare system across the board, and something that I'm going to touch on in a minute as to how the NDP thought we could start to address that. The other thing about it is that poor oral health is not just restricted to our mouth. It's kind of perverse that we cover our whole body in the public healthcare system, but we carve out this area of our mouths and we say that's not covered. But actually, untreated oral health measures lead to all sorts of serious medical conditions, including diabetes complications, cardiac problems, low birth weight in babies, and of course, if you have an infection of the upper jaw, that can go to your brain. An infection of the lower jaw can go to your chest. So it can be extraordinarily dangerous. So it's a very important, I think, primary health care measure that we worked to try to address this Parliament. Now, as Richard pointed out, providing dental care to Canadians was a primary demand of the NDP in our confidence and supply agreement. We had 27 separate demands that we put on the table as the price for us supporting the Trudeau Liberal government. And I want to be clear on this. This was not a shared agenda. This wasn't the NDP and the Liberals getting together and saying, well, what do we agree on? These were NDP core policies that we insisted be brought in that the Liberals did not want to bring in. In fact, both the Liberals and Conservatives repeatedly had voted against dental care policies and programs when the NDP had brought them in the past religiously. So I think it's very important to note that. The other thing that I want to point out is that the NDP believes very strongly that all healthcare should be delivered universally, comprehensively through our public healthcare system. That means everybody should get it, no matter what their income is, through our public system. Now, the Canadian Dental Care Plan that we were able to negotiate doesn't get there yet. And that's because this was the most that the Liberals were prepared to agree to at this point in time. But we think it's a significant step forward. We call it a down payment on universal dental care. So essentially what this is this will provide dental care to every Canadian who does not have any private dental insurance and who makes under a net family income of $90,000 per year. And so that's about 9 million Canadians that fit that category. And again, we won't stop working until everybody can get access to the services they need through a public system without any kind of means testing whatsoever. But this will make a huge difference to those that don't have coverage now. Now, I also want to say that we started with an interim benefit. Our confidence supply agreement had said that we would provide dental care to children under 12 by the end of 2023, and then we would provide 2022, and then we would expand that coverage to seniors, children under 18, and people with disabilities by the end of 2023, and then everybody who meets the criteria of under $90,000 who doesn't have dental insurance by the end of 2024. We missed the deadlines by a matter of months. So what we did is by the end of 2022, we established an interim benefit. So any parent that had a child under 12 who did not have dental insurance qualified for a payment, two payments of $650, so $1,300 per year, in order to go to the dentist until we could get the actual program up and running, which is up and running now. We also, and part of the reason for the delay was we had to tender the claims processing to the insurance industry, and that took a long time. We wanted to get that right. People have all seen what happens when government acts too quickly and they don't go through a proper tendering process. We saw that with the ArriveCan app, where we spent $60 million for an app that should have cost about $5 million. We saw the Phoenix pay scandal happen, where the Conservatives contracted out the payroll services of the federal government, and that led to years of problems. So we wanted to make sure this was right. And Sun Life, who was the ultimate bidder, told us in 2023 that they could enroll about 500,000 people per month. And so that's what we started doing in December of 2023. We started with seniors by age, and we started with people in their 80s, and then we gradually kept coming down through January, February, March, April, and by May, all seniors to the age of 65 will have been invited to enroll in the plan. And we are going to expand the plan on June 1st to children under 18 and those living with a disability who have a disability tax certificate. And then later this fall, we're going to get started by opening it up to everybody and who makes under 90,000 and who doesn't have dental insurance, who will then be enrolled, which will likely take us into the spring of 2025. I just want to read a couple things that I saw today in a news article from CBC. So the dental plan officially opened on May 1, so about 2 weeks ago. And that's when the first people who were enrolled were able to go to the dentist. And to give you an idea of the impact of this, here's the title from CBC: Broken Teeth and Infected Gums, 46,000 claims filed so far with the Canadian Dental Care Plan. 9,000 oral health care providers have signed up. And here's the first two paragraphs. Massive cavities, mouthfuls of broken teeth, bleeding gums, and abscesses. They're just some of the serious dental issues Dr. Melvin Lee has treated in less than 2 weeks of providing care under Canada's new public dental insurance plan. I've seen a lot of patients that have infections, not just dental emergencies, but borderline medical emergencies, the Ottawa dentist said. I haven't seen patients in this condition since I did overseas mission dentistry work in Haiti and Peru. Now, if you just stop there, you think of a G7 country as wealthy as Canada, where we had citizens walking around who are experiencing borderline medical emergencies and living really with third world health conditions, and yet we pride ourselves on having a first world healthcare system. So we think that this delivery of this system is the most important and most profound expansion of our public healthcare system in half a century. And as Richard said, millions of Canadians will now be able to go to the dentist regardless of how much money they have and be able to get their oral health care needs met. And we think that that is, we're very proud of that. We think that it's something that can be built on. And where I'll conclude is we did something else that I think is remarkable. Is this is besides a major expansion of public health care, it's historic because this plan is national and it's 100% funded and administered by the federal government. You know, people often think that healthcare is exclusively provincial. It's not. Healthcare is shared jurisdiction. The Supreme Court of Canada has said that. And while a lot of provinces have tried to have programs here and there for public dental insurance, none of them have ever really fully taken root. And so to have the federal government come in and establish a successful national program above the heads of the provinces and go directly to people and say, we will insure your dental needs, I think is a remarkable accomplishment. And it's something that we in the NDP fought very, very long and hard for. So I look forward to any questions you have about the program. There's no doubt that it's going to have some bumps along the way, and we built in a 3-year review of the program so that we can see where it's not working well and make improvements. And where I want to conclude, I started talking about the rural and underserved areas of Canada. One thing that the NDP insisted on was a $250 million oral access fund, which will be opening up for applications in the next month. And what that is it's inviting the communities across Canada to apply for funding in order to provide innovative, creative ways to deliver dental care to underserved communities. Some of the ideas I've heard are mobile dental clinics, special programs to go into elder homes where a lot of people are immobile and they can't come out of, to make sure we're bringing dental care into our seniors. I even heard a really creative proposal to outfit a rail car and have that rail car, go to communities along the rail routes and pause and bring dental care to communities so that people don't have to leave their communities. So there's all sorts of creative ideas that are coming from that, and that's going to be ongoing funding. The $250 million up front, and then I think it's $90 million a year thereafter in perpetuity, so that we can try to ensure that everybody, no matter where you live in the country, can have access to proper oral health. So I'll leave it there, and look forward to any comments Richard has, or any suggestions or comments or ideas that anybody in the audience may have. Thanks very much.
Well, thanks, Don, for that wonderful, precise history of where we've been and where we're headed. And when I look at some of the questions that I've had come into my office before we started this, some of the real concerns that we've been hearing both from patients and from dentists is there seems to be a reluctance of some dentists to actually sign up for the plan. As you mentioned, 9,000 dentists have signed up, and that's, I think, just under a third of the dentists in Canada. They might not be distributed evenly across the country. I know there seems to be relatively few in this riding that have signed up. Perhaps you could comment on that. But again, in that article you mentioned in the CBC, I read that as well, and there seems to be a feeling among the dentistry community that this is headed in the right direction and that dentists will sign up, and within a matter of months or perhaps a couple of years, this will be treated by dentists as just another dental insurance plan that they deal with every day. And I'm just wondering if maybe you could expand on that as to what options the dentists have, what concerns they might have, and how we're trying to address those. And, it seems to me that we had the same reluctance at the start of Medicare with doctors. And that I would suggest that fairly soon we're going to have a very well functioning insurance program, as I said, that will change the lives of Canadians.
Yeah, thanks for the question, Richard. Yeah, as a matter of fact, the doctors went on strike in Saskatchewan when Tommy Douglas brought in Medicare. He had to import doctors from the UK to provide services. So this has gone relatively smoothly compared to that. You know, I promise I am capable of a short answer, and I will get to some later, but I want to give a bit of a fulsome answer here. So I think it's important to understand um, uh, how we can get this program on a long-term footing. So I mentioned earlier, pretty much every province in the country at one time or another over the last 100 years has had some kind of public dental insurance. Often it's for low-income people, or it's for children, or whatever. Just about every one has failed. And the reason they failed is there's a couple of them, but one of them is that they pay substandard fees. Now, it's important to understand how dental fees are set in Canada. In every province, there is a dental association, and they set their own fees. These are not negotiated with anybody. It's not like doctors who negotiate with the province. Let's say the BC Dental Association will set out their own fee guide. So will Alberta, Saskatchewan, etc. And now dentists then use that fee guide to charge their patients as they will. So um, what's generally happened in the past is that governments have gotten cheap, and they'll set the fees that they'll pay these dentists for the poor kids or the low income people or whatever at a fraction of that, 40%, 50%, 60%, or maybe they'll start higher and then over time they drop. So it becomes a burden for the dental offices, who are then called upon to subsidize these programs, and eventually they just don't want to provide the services. So from the very beginning, when I started negotiating with the government 2.5 years ago, I was absolutely intransigent that the fees paid under the Canada Dental Care Plan should be 100% of the fees set by the fee guide in the provinces. Now, I didn't mean to tie it to them, because you couldn't say automatically we'll pay whatever the dentist set, because next year the dentists may jump their fees up 10 or 20%. But I said we should set our own fee guides, but let's set them at what the prevailing fee is, and we can always make adjustments or not as we go forward. Now, the Liberals didn't listen to that. So they put out a provisional fee guide at first. They floated this idea that set the fees at about 82%. So that's about what the average fees. Now, some were close to 100, some were less, but it averaged 82%. The dentists across the country, in my opinion, quite legitimately thought that was unfair. And I have always said, I don't think this should be a poor person's dental care plan, and I don't expect dental professionals to subsidize this plan. They are critical to its success, and they deserve to be paid appropriately. So after us continuing to work on Liberals and the dental associations working, and it's not just dentists, but it's dental hygienists, denturists, and dental assistants. They've got the fees up to about 89%, which is where they are today. Now, I still think that's substandard. In principle, I don't understand why we expect dentists to not get a full fee for what they pay. But this is one of the major reasons, I think, why dentists have been, and dental associations have been reluctant to sign up. I want to dispel a couple myths. This plan is just the same as any other dental plan there is. In fact, it's better. There's a 48-hour turnaround in reimbursement. So that means when you go to the dentist under this plan, when the dentist submits the bill to Sun Life, they're paid within 48 hours. That's like lightning. There's also very quick predetermination, and the administration is very, very smooth. So I don't want anybody to think that this plan is actually very, very well designed, but the fees I think are still a little bit low. But I think that's why you're starting to see more and more dentists come on board as well. Some won't, but as the fees go up a little bit higher, I think they'll come on. Richard, you said 9,000. I think that includes dental hygienists, the 9,000, and the 30,000 does as well. So you're quite right. We have about a third of the oral health professionals within 13 days of the plan being operative already on side, and I think they're going to keep coming. But in my view, we have to keep pressing to make sure that this plan is properly funded. And that's what the NDP's position has been. You know, Mark Holland, who I give a lot of credit to, he's a Liberal health minister. I worked very well with him. He and I have a different approach on this. He says he believes in radical incrementalism, which I believe is an oxymoron. So the Liberals, they're moving, I think, in a very incremental way, where I say, look, let's learn the problems of the history. And if the historical problems have been substandard fees, let's not make that mistake again. Let's stay on top of the fees, but let's make sure that dentists and hygienists get paid just like they get paid if Richard and I go to the dentist, or any of you that are listening, if you have a dental plan, you should be paid the same. And the only reason I say that is not only because of equity, but because it's, I think, important for the long-term sustainability of the dental care plan.
Well, that's another good summary of some of the background there. And one thing I've heard is that coming in July, dentists won't have to actually sign up for this plan. They can just submit directly to Sun Life if one of their patients comes in and wants to be covered. Can you elaborate on that? I'm a bit unsure of what the difference is, what's the difference to the dentist for signing up versus just submitting a claim directly to Sun Life without signing up.
Yeah, thanks for that, Richard. Yeah, so originally, in order to sign up for this plan, or to be able to bill, the dentist had to sign, were asked to sign a fairly short and relatively standard agreement that set out the terms of the plan. One of them, for instance, being that they cannot bill the patient directly. So they have to bill the plan and then get reimbursed. This is something the dentist wanted. They wanted to be able to bill the patient up front and then have the patient submit the claim and then get reimbursed. We resisted that completely successfully. But depending who you believe, the dental associations claimed that this contract was a bit onerous and was a reason why dentists weren't signing up. So what we pressed the government to do, and they did, was eliminate the contract then. And the contract now begins with the dentist simply submitting the bill to the plan. And when they submit the bill to the plan, there are certain conditions that they'll have to meet. But we removed that barrier because we didn't want any barriers between dentists and the plan's success. Dentists are key to this working. Dentists have to be willing to provide the services. And if they thought that signing the contract was a barrier, then we looked at it and we said, okay, you don't have to do that. So starting in July, all dentists have to do is do the work and then submit the bill to the plan, and they'll get reimbursed. And that's to make it administratively easier.
Okay. And now I have a question here in the chat about people with disabilities that will be eligible to sign up for the plan shortly. And there's this, I think, kind of an ongoing issue with federal programs dealing with people with disabilities is that, and we've heard this with the more recent reports on for people with disabilities across Canada, that they need to have that disability tax credit with the federal government to apply. That covers about half the people on disability in British Columbia, for instance. Wondering if you could comment on that and how that will affect the dental coverage.
Yeah, as I said, Richard, in our agreement with Liberals, we agreed that we would cover seniors first, and then children under 18 and people living with disabilities, and then everybody in that order. So we were folding them in and enrolling people in that order. So the question became, how are we going to define people living with disabilities? And in principle, the NDP said we should use the widest definition, which is anybody who's in receipt of disability payments from a province. That's everybody. And the Liberals wanted to cover people with a disability tax certificate, which is, only, as you say, about half of people, because a lot of people live with disabilities and they, for some reason, have not applied for their DTC federally. We ended up agreeing for two reasons. One is the federal government, in order to get this plan up fast, the federal government knows who has a DTC. They don't necessarily know who's in receipt of disability payments with the provinces. So they would have had to sign agreements with every province and territory to exchange that information. And that put control in people like Danielle Smith's hands, who, by the way, didn't want the dental care plan. So the DTC, though, the feds know who that is. But the more important reason is it's not that important of a distinction because people with a DTC will be invited to apply in June. But by the end of this year, everybody will be invited to apply regardless. So it's a distinction that only will affect you for a matter of maybe 4 or 5 months. So that's why in the end we thought, well, it's not that critical of a distinction because that person who doesn't have a DTC will be able to apply probably in November, December anyway, maybe early in 2025. So it wasn't an issue that turned out to be all that important. But if we had made the criterion different than the DTC, we'd probably right now still be embroiled in deep negotiations with provinces about exchanging that information, and many of them probably wouldn't even do it. So it was a very practical solution that we took. I
Right.
also wanted to say for a second, in terms of the services, we fought really hard throughout the negotiations to make sure that this plan provided extra services for people living with disabilities. So, for instance, if you're nonverbal, or if you use a chair, or you need to be sedated under general anesthetic, we worked hard to make sure that this plan would provide additional units of care if you needed it, and we got that. So the plan, for instance, might say that you get, I think it's 4 units of cleaning per year, but if you need more, or if you need sedation, then your dentist can apply to the plan, and if it's medically needed, you will get extra units because this plan doesn't have monetary limits like a lot of plans do. It's intended to give you the care that you need based on medical need. So it's something we'll keep a close eye on, but we hope that this plan will be better for people living with disabilities, and they'll be able to get the dental care that they need that a lot of dental plans, even if you have coverage, don't provide.
Okay, and I'm just wondering if you've heard anything about how Sun Life is managing these enrollments. I have a question here from someone who said that they have got a letter confirming 100% payment in the dental plan on January 25th, but they've yet to get their package from Sun Life, and Sun Life said they were overwhelmed. Just wondering if you've heard that, or if that has been sorted.
Yeah, I've heard a little bit of that. I mean, by and large, the main story I've heard is that it's the enrollment process has gone very smoothly for most people. But I have heard the odd case of someone who hasn't received their enrollment card in the mail. Um, I think if you go on the website, I think you can find a contact number and you can call to follow up. My experience has been when people follow up with Sun Life and check into it, that it's been resolved relatively quickly. But you could always call, Sun Life or your MP's office to look into that as well. But it is 500,000 people a month is a lot of people to enroll, and so far it's gone quite well. I know that all people over the age of 65 should have been invited to apply by now, and there's a breather of May, and then June 1st, that's when they turn to children under 18 and people with a disability tax certificate. But if you have any problems, call them or call your MP, and I'm sure we can straighten it out pretty fast.
Okay, now I have a question here from a dentist, and I've read this in news reports online as well, that one of the issues dentists were concerned about and made them reluctant to sign up to the plan was that there were terms and conditions that they were asked to agree to, and one of them was that in some cases they would be sharing their patients' health records with Sun Life, and that is apparently not what is done in other dental coverage, insurance coverage schemes, and so they were reluctant on those terms, that they didn't want to share those health records. Is that something that is being resolved, or?
Yeah, I think it is, and I have heard that concern. The reason that that was there, I'm told, was for auditing purposes. So, this being a federal government program and this being taxpayer dollars, there is, and I understand that there's an audit provision in every kind of dental care plan that there is. So if they see, an unusual billing pattern, or if they suspect that there's errors or improper use of the plan, that insurance providers have the ability to come in and audit. I am aware of that concern about uh, turning over the patient records. I'm not, to be honest, I'm not sure if that is uncommon or not. I take the dentist at his word that it's not the case in other plans, but that's the reason for it. And I think that is being worked on. Nobody has designed this plan because as a way to get patients private medical insurance. And I understand that even the audit process is only there if they detect a very, very unusual or problematic billing pattern. So I think it's an issue to look at, and I'm sure it will be resolved.
Okay, and another, because this isn't one of these universal public plans, it's only for people without coverage. There has been some questions around what about people who have coverage, but it's not very good coverage, or they're seniors, they don't have a lot of money, but they've thought we should spend some of our hard-earned money to get dental coverage. It's not very good, but now they are worried that they're not eligible for this, or veiled threats from companies who have a dental program for their employees are now saying, well, we don't need that anymore. We'll just drop that coverage from our package for employees and they can get it from the government. Can you maybe comment on those issues?
Yeah, it's we did an enormous amount of work on this and consulted so widely with every kind of stakeholder group. But it's funny, Richard, that there's always a couple of unintended things that happen. And you put your finger on one of them, which is we designed this plan from the beginning to provide coverage for people that don't have dental insurance. And, that, as I said, is 9 million Canadians. But in the course of designing this, what we realized at the very end is that there are some people, particularly those with post retirement benefits. So you go to retire at 65 and you have an option to continue your extended health benefits. Usually you have to pay out of pocket for it. But what we've discovered is that often the benefits you're paying for are very substandard. Sometimes it can be really good. Some people have really good post-retirement benefits, but others it's really bad. I was talking to someone who said they have like a $750 a year limit on dental insurance, and so those people, um, um, originally by the terms of the plan that the NDP negotiated, they could have dropped their insurance and joined the CDCP. But I think when the Liberals saw that this was happening, and those people were calling Liberal MPs, the Liberals moved unilaterally to close that gap. And so they said, nope, if you have any kind of dental insurance, no matter how substandard it is, or if even you retire today, for instance, and you could opt for post-retirement benefits, you don't qualify for the CDCP. Now, the NDP has fought that. What we say is that everybody should have a one-time option. Our position has been, if you have substandard care, or if you could choose to have post-retirement benefits, you may elect, in our view, to join the CDCP. But we have been unsuccessful getting Liberals to agree to that. This is something that I think we're going to have to put a pin in for the future. The main thing the Liberals were concerned about was what happens if employers drop their plans. And by the way, a lot of the dental associations were concerned by that as well. They don't want employers to drop their plans. So I think that's why they've taken a very hard position by saying, no, if you have insurance or if you could have insurance, you don't get covered by the CDCP. This plan is only for people who bona fide don't have dental insurance. I don't agree with that, but that's how the plan has been rolled out so far. And hopefully, if there's an NDP government in the future, we will expand it. Because in my view, um, the purpose of this should be to get everybody in this country on a good dental plan, provided publicly if possible, or it should be at least as good as a private plan. And it should be wrong if any policy results in people being forced to continue to have substandard dental care because of a bureaucratic rule. I think that's wrong. But uh, we're not the government. We've used our power as much as we can, and this was the Liberals' decision, and we'll keep fighting for all those people until everybody can have coverage at least as good as the CDCP, which, by the way, I haven't had a chance to talk about, but it's a very good plan. You know, it's soup to nuts. Like, this is a standard dental plan, from diagnostics like examinations and x-rays to prevention, that's scaling, polishing, sealants, fluorides, fillings and crowns, root canals, deep scaling, root planing, oral surgery, prosthodontics, that's partial dentures, real dentures, full dentures, fillings and crowns, sedation, and even orthodontics if it's medically necessary. So it's a very good normative dental plan, and I'd like to see every person be able to join it if they want to.
Okay, following up from that, I have a question here. Someone's asking, they say, when I do the math, the number shows only $288 per patient is budgeted per year. I'm not sure what where those numbers come from. I assume it's how much the government is saying this is going to cost and how many people it will benefit. So I'm guessing that 288 is an actuarial average of how much people will spend on dentists. And then they take it from there and say, they say this is a very low number for many people, and that, are you asking dentists to absorb the shortfall? And I think from what you've said before, the answer would be no, in terms of, you say it's 80 to 90% or something of the fees that dentists will charge. So this $288, I assume, is an average, and it will be like any other dental coverage.
Yeah, I've got to say I've never heard that number before. I mean, I'll tell you, I'll repeat again. When we established the interim benefit for children, it's $1,300 a year. I was told at the time, like, that was two payments of $650. The first $650 would buy an exam, a cleaning, and a filling. So if you double that, think of, in a year, having two cleanings, two fillings, and two exams. That's pretty normative, and that's $1,300. Now, starting in June, those children will be folded into the real dental plan. But there are no actual annual limits on this plan. So unlike normal plans where you get maybe up to orthodontics up to 2,500 a year, or crowns up to so much per year, this plan will actually pay as much as you may need to. I also think what's important is you have to think of the population that's going to be going to the dentist. By definition, these are people without dental insurance and low income. So I expect that most of the people going to dentists will have people who have not been to the dentist in quite some time. So I think you're going to see far higher average amounts of people going to the dentist and than the 200 and whatever dollars that is. I think it's going to be significantly higher than that. Interestingly, there's this concept called utilization rate. So even people covered by dental plans, Richard, not everybody goes. I think like a 40 or 50% utilization rate a year is kind of standard, meaning about half the people who have dental insurance will actually go to the dentist in a given year. Sometimes that's for need. People who have good oral health care and who have good oral health practices maybe don't have to go, although you should go once a year for a checkup and once or twice for a cleaning, I think. So the utilization rates for the CDCP are expected to be significantly higher than that, probably in the 60 to 70, maybe in the 80% range, where people who have not been able to go to the dentist because they couldn't afford it start to go. So I don't know about an average, but I'll tell you, what did I say? 46,000 people have gone to the dentist in the first 13 days, and a lot of the description of what they're getting: bleeding gums, extractions, significant dental work. So I think this is going to be a very impactful program providing really good services for a lot of people who have had to ignore their dental needs for a long time. And frankly, that's a national shame in a country as wealthy as Canada.
Yeah, and I just got a clarification from Mike, who was apparently the person who asked that question, who said he took the $13 billion divided by 9 million candidates, divided by 5 years, and you get $289 per person per year, which is not very much when you consider what it costs just to go get your teeth cleaned a couple of times a year. So, uh,
Well, the other thing I would say, Richard,
about
is
that.
remember that's what's been budgeted.
Mhm.
Like, when you budget over 5 years on a brand new plan like this, you make an assessment and you make some assumptions. I personally think that it'll probably be higher than that. I know they budgeted 13.5 million over five, and then I think it's 4.4 billion per year thereafter. I have a feeling it's going to be higher, but we'll have to wait and see what the experience is. What the utilization rate is, but I have a feeling it's going to be higher. And that's a good thing, because that means people are going to the dentist and getting their dental needs done. This is not a cosmetic plan, right? So you can't get veneers, you can't get your teeth whitened. So those things you'll still have to pay extra. This is medically necessary dental work. So, I think as Canadians, we have to ask ourselves, do we believe in our public healthcare system that everybody should be able to get their medically necessary oral health needs met, regardless of their ability to pay? Or do you think that if you're poor, you shouldn't be able to? 60 years we've gone with liberals and conservative governments saying that they're okay with that. We're not, and the NDP have forced this government, just like we forced them to bring in universal public health care. And people resisted it at the time. They said, oh, you wouldn't be able to get your choice. Doctors didn't like it. People said, it'd be substandard. Now I think Canadians cherish their public healthcare system. Yes, there's tons of problems with it, and it needs to be improved, primarily, I think, because of underfunding by successive conservative and liberal governments. But barring that, I don't think Canadians would trade our public healthcare system for, say, a two-tiered system like the Americans have. I think we believe strongly that it's a right of citizenship. People should have access to healthcare regardless of how much money you have in the bank.
Okay, and I've got another follow-up question from the dentist online who was asking why was the decision made to go with a private insurance company with, in this case, Sun Life, to put it out to tender rather than just make it a government program. This dentist has patients in the Healthy Kids program, plan for special needs adults that are run by government without private insurance company getting in the middle of it all. Why was the decision made to do it through a private insurance company?
Oh, well, an excellent question, and I very much I want to thank the dentist for that question, and it's a sentiment that we share. So, tell you a little inside ball. When I first sat down with Minister Duclos, he was the Liberal Health Minister at the time, and his senior bureaucrats, they looked at me and they said that the dental care plan the NDP was pushing for would take 7 years to bring into existence. And I laughed for a moment and I said, World War II took 6. Uh, so 7 years to add 9 million people to a normal dental plan was ridiculous. But that's the kind of bureaucratic resistance we had. The reason we went this way, I agree. If this was an NDP government and Richard was Minister of Finance and I was Minister of Health, what I would have done is create within the federal health ministry a dental processing unit where you have public administration of the dental claims. Because public administration is a core principle of the Canada Health Act. There's no reason you couldn't do that. You stay in control of the processing. The federal government's paying the freight, so why shouldn't we do the processing? Couple things. At the time, on the 2-year time frame that we had, we didn't think that we could get that department inside the health department ministry set up in time. And there, we were afraid that rushing that process, particularly at a time when it was hard to find people, you may think over the last couple of years, it's been hard to find um, qualified staff. So you'd have to find probably like many, many hundreds, maybe, yeah, I would probably say many, many hundreds of people, and train them to process claims within the Ministry of Health. And there was concern that that couldn't be done effectively and efficiently in time. The other reason is right now, prior to the CDCP, there are 4 dental plans that are currently administered by the federal government. One for Indigenous people, that's called the Non-Insured Health Benefits Plan. There's one for the Canadian Armed Forces. There's one for public servants, including MPs, but all the civil service. There's one for refugees and immigrants, and I think people in federal institutions. All 4 of those plans are the claims are processed by insurance companies. And in fairness to insurance companies, this is what they do. This is their expertise. What insurance companies, they process claims. They don't deliver the services. They don't, they don't have anything to do with that end. They are professional claims processors. And so they have the infrastructure set up. They have the computer programs. They have the skilled staff. And so we thought, given all those reasons, it's very important that the CDCP, being the very first federal national health insurance plan, that it be done correctly and that it work. And so we thought, at least in the first 5 years, let's give the claims processing to the insurance industry who has expertise in doing that. We can always move it inside later if it proves necessary. So that's what the decision making or thinking was.
Okay, I think we'll, with the time that we have remaining, maybe for the next half hour, we can turn to Pharmacare, the other big healthcare program that we've been working very, very hard on. You have, I know, Don. And this is a different sort of plan because it will be a universal, publicly funded, publicly operated single payer plan where everybody will be part of this plan. And so that's in its first stages. We have the legislation in process now, and we have 2 big new parts to that plan that will be in place by the end of the year. And one of those is free contraception for Canadians, and the other is free drugs for diabetes sufferers. Millions of Canadians suffer from diabetes. We invented insulin here in Canada. We, Banting and Best, and then gave that to the world. And yet thousands of Canadians die every year from complications from diabetes. I had a friend, 27 years old, who died from diabetes complications. These are needless deaths simply that come from lack of access to insulin and the products needed to monitor their disease. So I'm just wondering if you could talk about perhaps those 2 points, but also generally the difference between the Pharmacare plan and the dental care plan, in that it is a national universal plan that will not cost Canadians, but actually save Canadians billions of dollars a year.
Yeah, thanks, Richard. Yeah, so I would say the dental care and the pharmacare are 2 of the flagship parts of the Competence Supply Agreement. There's some other really important things in there, like the Long-Term Care Act, anti-scab legislation. There's some really critical pieces, but they were negotiated very differently. So dental care was negotiated specifically in the Competence Supply Agreement in the way that I've described. So it was means tested under $90,000 a year, and it had the criteria of people not having. So it was not designed to be universal or comprehensive. And the reason for that is we haven't really done the work in order to fold dental care wholly into the public healthcare system. The economic work hasn't been done. The work with dentists and the profession has not been done. So this was considered a much more logical bite not to use a bad metaphor, a good step towards providing dental care to people, and while maintaining the way dental care is provided for people who already have private coverage. Now with Pharmacare, it's a lot of that work has been done. So there's been 7 different studies over the last 40 years that have looked at pharmaceuticals and said, look, um, 1 in 4 Canadians is not taking the medication that they need because of cost. So how do we make sure that people can get their medication? And the recommendation 7 times out of 7 has been to fold prescription medication into our public healthcare system. I use this example of, if I fell down right now and broke my arm, hopefully my staff would pick me up and drive me to the hospital. I'd go in, I'd get my arm fixed, and I'd be treated, and I'd come out and I'd never see a bill. Now people would be paid, the whole system would be paid, but it'd be publicly covered comprehensively through the public system. Now, if I fell off my chair and hit my head and instead went to the hospital, if the treatment was instead a medication, well, different ball game. So now, okay, well, if there's a prescription given, am I covered at work? If I'm not, do I have to pay for it? The hospital will give me some pills to get me started, but when I go to refill it, whether or not I can get my prescription filled or not depends on if I have private coverage. And, about 1 in 5 Canadians doesn't. So that means there's, 8 million Canadians walking around right now as we're having this Zoom meeting who don't have any prescription coverage. So what we said in ACASA was we would continue to make progress towards universal national pharmacare by introducing legislation this year, by the end of 2023 it was actually, and by establishing a bulk buying program and a essential medication formulary by the end of 2025. So what we negotiated with Liberals was we said, okay, what does that legislation look like? We insisted that the legislation be faithful to the Canada public healthcare system. So we got references in the preamble and in the Act itself to say that the federal government will continue to work with the provinces towards bringing in single-payer pharmacare. That's pharmacare through our public system. We got them to agree to in the legislation to establish the bulk buying program and an essential medicines formulary within 12 months of this bill passing, getting royal assent, which we expect to happen at the end of June. So that means by probably July 2025, this government has to have an essential medication formulary, and they have to have a bulk buying program. But we also said, let's get started. So we forced them, as you pointed out, Richard, to start delivering 2 major classes of drugs through the public system. And that is diabetes class drugs and devices. The devices are important. That means insulin pumps, continuous glucose monitors, test strips, and syringes and needles, and also contraceptives. And we actually negotiated exactly what drugs will be covered. It's extremely comprehensive. And the deal will work this way. Once the bill becomes law, which we think will happen by the end of June, the federal health minister will be able to sit down with any provincial premier and say this. We'll say to the provinces, if you continue to cover the people you're covering now, so that's people on welfare, people on disability, just keep paying for the diabetes medications and supplies for them and contraceptives. We will give you whatever extra money is needed to provide coverage for every citizen in your province through the public healthcare system for those 2 classes of drugs. So that means that when a premier signs on that, someone will be able to walk into a pharmacy, hand over the prescription for insulin, walk out with their insulin, and it'll be paid for by the public system, backstopped by the federal government, which is exactly how our healthcare system works, right? The federal government transfers money to the provinces, and the provinces add some money to it, and together they provide universal coverage through the public system comprehensively with no cost to the patient. No co-payment, no income testing, it's universal. Doesn't matter if you're a millionaire diabetic or if you're a poor person diabetic, you get your medication covered, just like you do if you need heart surgery. And so this is a historic breakthrough, the first 2 classes of drugs ever delivered in Canada through the public healthcare system. We would have liked to have seen more, but this is the most we could get the Liberals to do. But we got our toe in, and we want to demonstrate that by delivering prescription medication through the public healthcare system, not only will we keep people healthier, but we will save money. Because when you give people the medication they need when they need it, you prevent them from getting sicker down the road. I'm going to end with one really crisp example. We heard evidence when we were studying this at the Health Committee in 2017 that if one diabetic does not get their medication and they end up in intensive care, that one intensive care visit will cost our system more money than it would have costed to provide free insulin to that person for life. So that's very stark. So it makes sense to make sure people have their medication. When you keep people healthier and you prevent serious illness, there's actually an economic benefit and you save money down the road, in addition to the main priority, which is keeping Canadians healthier, because we want everybody to get their medication. I lied. I want to say one last little thing about the devices. Think of this. If you had a 5-year-old daughter who is a type 1 diabetic, and she has wildly fluctuating blood sugar levels. I heard stories where parents have to wake up their daughter every hour and a half, starting, put your child to bed at 9, 9:30, 10 o'clock. Imagine waking them up at 11:30, 1 in the morning, 2:30, 4 in the morning, and test their blood sugars and perhaps give them insulin. That's why the NDP fought so hard to say that child should have a continuous glucose monitor and an insulin pump so that that child can go to bed and get a full night's sleep, and so can the parents, as well as avoiding the danger. But this is the kind of thing that we think is part of core primary health care. And so we're very proud of this. And again, when the NDP is in power, we will expand this coverage to include all essential medications. And frankly, it should include all prescription drugs that are medically necessary, should be delivered through our public healthcare system. If we do that, it's been estimated that we'll save somewhere between $4 and $11 billion a year.
And those savings come from both the single payer part of the plan. We can negotiate those prices better, and
Yeah,
and also the savings on people not going to ER, ending up in hospital.
yeah, you hit the nail on the head. That's two of the big three, Richard. It's bulk buying. Bulk buying. Imagine if you're buying a prescription medication like Lipitor on behalf of 40 million Canadians. It's the Costco principle. You're going to get a hell of a lot cheaper price than if you're going to the corner store. Number two, cost-related non-adherence. That's the fancy word for when people don't get their medication when they need it, they get sicker and it costs more. And the third one is streamlined administration. Listen, this is shocking what I'm about to say. In the Hoskins Advisory Committee hearings which studied Pharmacare, they wrote that there are 100,000 extended healthcare plans in Canada. I still can't even get my head around that. 100,000. Imagine replacing that administration with one medical services plan per province. So the streamlined administration that you get saves a lot of money as well. So those plow savings back into the system. And that's not the NDP who's estimated that. That's the Parliamentary Budget Officer has done it twice. That's economists at University of British Columbia have found that repeatedly. Study after study has shown that those three factors can save us billions of dollars, and we can cover everybody. So by reorganizing our system in a more efficient way, we can cover every Canadian and save money. It's rare you see a health policy that is good for health and saves money, but this is one of them, and it's been found repeatedly.
And I know just you mentioned Lipitor, which is one of the commonest, statins drugs that is prescribed for people across this country, around the world. And you mentioned the Walmart factor. I think I heard somewhere that New Zealand, which has a single payer plan for drugs, and Lipitor is one of those. People in New Zealand pay 1/10 the amount for Lipitor that Canadians pay, and New Zealand's a country the size of British Columbia, you know, so that's the kind of savings we could see all across the board. And
Well, you're
that's
right,
why,
Richard. And you know, it's funny, lest we think this is revolutionary, Canada is the only country that has universal health care that does not have some form of universal prescription coverage. And we also pay, depending on the source, either the second or the third highest prices in the world for prescription medication. So, you know, this is an economically smart idea as much as it is a progressive health policy as well. So we're really proud of this policy, and it should be expanded. But we'll get started with, and you know, on contraception, if we just talk about that for a moment, you know, there's 10 million people of childbearing capacity in the country right now, and to ensure that every one of those people can be in control of their reproductive health is huge. And you know, things like some contraception is not that expensive, but things like IUDs can be cost prohibitive. And particularly if you're young, if you're, you know, a young woman and you don't have much money, or your family doesn't, and you can't talk to your parents about it, being able to go and make sure that your reproductive health needs are taken care of is a big question of a big issue of autonomy, I think, and equality as much as it is of health. So these are two major classes. I'd love to see this expanded to cover the antihypertensives, as you pointed out, the statins, the antibiotics, and that's the purpose, Richard, of in the next 12 months we force the Liberals to then expand the formulary to cover all essential medications. And there's a couple different models of that. There's the WHO model. There's one out of Ontario, and that's like 80 to 150 drugs that are added of the most common prescriptions. So that's why we established this legislation, not only the delivery of these two classes of drugs through the single payer system, but also we laid the foundation and the framework for a future expansion to have true comprehensive universal public pharmacare in the future. Of course, you know, what I'm really worried about is Pierre Poilievre, because he voted against it. By the way, the Liberals did too when we were in opposition. Both of them did, but we forced the Liberals to do it. But the Conservatives, they will, without, in my mind, there's no doubt that they will try to reverse these if they get into power. So I think Canadians will have a very important health decision to make next election. They'll have to decide if they think they want an expansion of our public healthcare system or if they want it rolled back. And that's going to be a very stark choice facing Canadians next election.
and thanks. I have a question here about expanding that coverage for diabetes to expanding it to subsidize the prevention of diabetes. And there, as always, talking about testing with strips and lances is not covered I guess if you don't have diabetes. But if you are concerned about developing it, as she says, her family is diabetes runs in her family. Is that something that's considered here, or?
Yeah, that's a great question. I mean, what that question made me think of, Richard, was one of the exceptions in we got a great list of insulins covered, and there's a whole bunch of different specialty medications in there for both type 1 and type 2 diabetes. But one drug that is not covered is Ozempic. And I think that's something that we may have to look at covering in the future. So Ozempic really is prescribed to help with weight loss. And weight loss is a very important way that someone can control their diabetes. And in some cases, with type 2, you can actually avoid it. The problem with Ozempic right now is that it's brand name. There is no generic. It's extremely expensive, and it's being prescribed off-label, which means that it's being prescribed and used and paid for by people who don't have diabetes, but they're using it as a weight loss control. So the advice we received was not to cover it at this point. But that could be added in the future. But the person is absolutely right that, you know, if it's one thing I've learned as health critic over the last 8 years, and by the way, I changed to finance critic in early April. I was going to joke, health critics don't die; they just get more critical. But the if it's one thing I learned as health critic, it's that our grandmothers were right. An ounce of prevention is worth a pound of cure, and we really need to focus and invest more in preventing illness. We have a very good system for dealing with people once they're sick. Like our dentist, for instance, fabulous dealing with issues once they arise. But as any hygienist will tell you, and a dentist will tell you, it's way better to prevent that problem in the first place. So we need to do a much better job, I think, preventing these illnesses rather than treating them once they develop.
And one of the differences again between the dental care program and the Pharmacare program is that Pharmacare will be rolled into our national healthcare program. And so, as you described at the start, it's necessarily a negotiation process between federal government and the provinces. And I'm just wondering how you expect that to go, certainly with the first two, the contraception and the diabetes piece, but also hopefully within, I'm not sure, a year or two, but maybe more, of expanding that to cover all prescription medicines, how how the provinces will go with that.
Well, I can answer that both in theory and with some solid information, Richard. My understanding is that the provinces are raring to go. They can't wait to get this bill passed through Parliament and start negotiating. And the reason for that is clear. Again, Richard, if you were Premier of BC, and I said to you, Richard, I'll give you whatever money you need to cover everyone in your province for diabetes, medication, and devices and contraception, you'd leap at it. Like, why wouldn't you take it? I mean, it's free money from the feds to make sure that all of your residents have the coverage they need. So, and by the way, I've heard even Alberta chomping at the bit. Everybody is. I mean, the only exception will be Quebec, who will probably want the money, and as long as they meet the conditions of the act, they usually opt out. As long as they, and Quebec, by the way, already has universal pharmacare. It's a hybrid system. It's not quite what we would like to see, but they cover their residents better than anybody else does. But they may get the money on the condition that they meet the same standards. But I think every province is going to do it. In terms of expanding the coverage, well, that depends on politics. We take our healthcare system for granted in this country, but if we didn't have an NDP government in Saskatchewan in the 40s, showing that public healthcare works, if we didn't have two minority governments in the 60s, where the NDP held the balance of power and Tommy Douglas was the opposition leader, forcing the Liberals to bring in public healthcare, we probably wouldn't have it today. And here we are, 50 years after the 60s, where we had two consecutive Liberal minority governments again, with the NDP holding a balance of power, and we forced the Liberals to bring in, a major step forward in dental care and the beginning of Pharmacare. But if you don't, I'm sorry to be partisan, but it's just history. If you don't have an NDP government or a minority government where the NDP holds a balance of power, I don't think you're going to have that expansion. The Conservatives are opposed to it. They don't even want an expansion of our healthcare system, and the Liberals will only do it if they're forced to. The Bloc Québécois, of course, they're only concerned about Quebec. So, that's the political reality here. And I don't want to sound fear mongering about it, but elections are about choices and they're about priorities. And it disturbs me that Pierre Poilievre, he seems to be popular among a lot of working people. I think Canadians have to be very, very, very clear on what they're going to lose if there's a Pierre Poilievre government. He will take away dental care and he will take away pharmacare. It will not be expanded. Now, if people don't care about that, I guess they don't care. I do. And so, I would like, the NDP, we often say, Richard, we believe in head to toe healthcare. Like, we do have a weird system. It's not comprehensive. We've got great hospital care, great physician care, but dental care is a two-tiered system. Auditory care for your hearing is a two-tiered system. Eye care is two-tiered. Mental health is two-tiered. So if you have money, you can, or if you're lucky enough to work and have benefits, you may be covered. If you don't, you won't. And I think everybody should get the health care they need comprehensively, head to toe, based as a matter of citizenship. And so that's why the NDP keeps driving that agenda forward on it. But it only happens when we have NDP MPs in Parliament willing to fight for it. Like
Well,
you.
and you have really dedicated, I think, several years of your life to this, and I really want to thank you for that service, as well as uh, being on the call tonight here to explain some of the background to this, why we ended up where we are on both these big programs, where we hope to be, where we see this going. And as I say, the dental care plan is rolling out. There, that article mentioned, and as we've been hearing, there are, and there surely will be some bumps along the way, but within a matter of months or a year or so, this will be treated like any other dental care uh, insurance plan in Canada that most Canadians have. It's just, that 20% or so of Canadians that don't have, and it really, really affects their lives negatively. And it doesn't have to be that way. And that's where I think we come in to press for that in Canada, both for dental care, pharmacare. And as you mentioned, some people ask me, when are eyes and ears coming? And we can, we can hope to see that in our lifetime. But I think we've made huge strides here in the last couple of years on these very important issues. And again, I just want to single out you, Don, as being one of the people that has really, uh, it's hard not to explain to people how important your role has been. So thank you so much for doing that and being here tonight. And we really appreciate your work, and I hope you enjoy being a finance critic, but glad that you were the health critic during these.
Thank you, Richard. It's a real pleasure. And, this was a team effort. It took a lot of people. I want to thank all of the health professionals who have been working for years for this as well. All the stakeholder groups. There's been a lot of retiree groups, trade unions, citizen groups, patient groups, um, who have all, I think, played such a key role in this. And, it's a real privilege for us to be able to represent people in Parliament as you've done so well, Richard. And, I think I think it's so rewarding when you can actually work together with a wide variety of people. And I want to even congratulate my colleagues in the Liberal Party. Jack Layton used to say that it's our job to make Parliament work for Canadians. And, by working together across party lines, I think we can say that we're going to make life better for a lot of people in a very concrete way. And this is a very important class issue. When people have teeth problems, oral health problems, it affects their self-esteem. When you're living with pain, it affects your mental health, affects your job prospects. We wear our mouths on our faces. And I think this is a really, really important thing, especially for kids and especially for seniors. I didn't get a chance to say that if a senior, doesn't have dentures or partial dentures, it affects their nutrition. They can't eat hard apples, they can't eat things, and then when their nutrition is poor, their systems break down. So it's been a real privilege to work with you and all my colleagues. We all work together really hard on this, and it's rewarding, I think, to have played a small role in improving Canadians' health. So thank you, Richard, for all your contributions and being such a strong advocate for these health programs and everything else that you're working on as well.
Well, thanks, Don. And I'd like to thank everyone who joined us this evening on this Zoom call, and I hope you found it interesting. If you want further information, if you have further comments, please get in touch with my office. We're easy to find on the internet and in the phone book, etc. So I really look forward to talking with further if you wish. I think one of the most important issues that we are working on in Parliament right now, and I'm so proud of what we've done over the last few years. So, and thanks again to everyone for coming out tonight. I think we'll just close it off there and hope to see all of you sometime soon or hear from you at the office. So thanks, Don, and thanks to
Thank you,
everyone.
everyone, for joining us.
Good night.
Thanks, Richard.